CPT modifier play a crucial role in medical coding, providing additional information to describe a procedure or service rendered to a patient. Welcome back. In this video today, we will wrap up our series on CPT modifiers. We will unravel the remaining modifiers, unlocking their unique roles and application. In this video, we also have question and answer session. Welcome back to my channel. If you are new to my channel, welcome to MedCode Inside. Hi, I am Nishaba, a certified medical coder. In the previous video, we have covered some important modifiers and their function. Today, we will further explore the modifiers commonly used in medical coding. Let's get started. Modifier 78. CPT Modifier 78 is a healthcare billing code used to indicate an unplanned return to the operating room for a related procedure during the post-operative period. Patient is taken back to the operating room to take care of the complication during the post-operative period of the initial procedure. It helps in billing for additional services related to initial surgery. Let's take an example. A coronary artery bypass graft was performed, and later in the day, patient was taken back to the emergency room to take care of the post-operative hemorrhage. In this scenario, we will use the CPT code along with modifier 78. Keywords used in the procedure for the modifier 78 is complication had to return to the operating room. Modifier 79. CPT modifier 79 is used in the healthcare billing to indicate an unrelated procedure or service performed by the same physician during the postoperative period. The subsequent service is distinct and not directly related to the initial surgery. Let's take an example. A surgeon amputates a patient's right little finger because of an infection. Within the post-operative period of this surgery, the same physician amputates the patient's left little toe after it is crushed in an accident. Modifier 79 would be used on the second surgery code because the two operations are completely unrelated even though they may seem similar. Keywords used in the CPT procedure to apply modifier 79 is not related to the previous care. Modifier 80. CPT modifier 80 is utilized in healthcare billing to indicate that one physician assists another physician in performing a procedure. If an assistant surgeon assists a primary surgeon and is present for the entire operation or a part of the operation, then the assisting physician reports the same surgical procedure as the operating surgeon. The operating surgeon does not append a modifier to the procedure that he or she reports. The assistant surgeon reports the same CPT code as the operating physician with modifier 80 appended. Let's take an example. For excision of parotid tumor, once the patient was under general anesthesia successfully, Dr. White, assisted by Dr. Green, opened the area to excise the total gland. The wound was clean and closed. Report Dr. Green's service. In this scenario, we will use the CPT code along with 80 modifier. It indicates that during the procedure, Dr. Green assisted the Dr. White. For CPT modifier 80, keywords terms include surgical assistants, assistant, co or additional surgeon, operative assistant. Modifier 81. CPT modifier 81 is used when services of an assistant surgeon is for a relatively short time. At times, when a primary operating physician may plan to perform a surgical procedure alone, a minor problem is encountered during the operation. It requires the service of an assistant surgeon for a relatively short period of time. This is considered a minimum assistant surgeon. In this instance, the second surgeon provides minimum assistance for which he or she report the surgical procedure code with 81 modifier appended. This modifier is not intended for use of non-physician assisting at surgery like nurse practitioner, physician assistant, registered nurse. For CPT modifier 81, key terms include assistant surgeon for a relatively short time. Modifier 82. CPT modifier 82 means assistant surgeon when a qualified resident surgeon is not available. In certain programs or facilities like in teaching hospital, the physician who generally acts as the assistant surgeon is a qualified resident surgeon. There may be times when a qualified resident surgeon is not available to assist the operating surgeon, so a physician assists the operating surgeon in this instance. This modifier is not intended for use by not physicians assisting at surgery, like nurse practitioner, physician assistant, or registered nurse. Let's take an example. Dr. A is preparing to perform an open heart surgery. Dr. B is asked to assist because a qualified resident surgeon is not available. The common keywords used in CPT to use modifier 82 is qualified resident surgeon is not available. Modify 90. CPT modify 90 means reference outside laboratory. Modify 90 is used to identify the laboratory procedure performed by a party other than the treating or reporting physician. Modify 90 is used to bill for the lab services purchased from an outside lab. Let's take an example. A patient comes to the office for an automated complete blood count. The blood is drawn by the office staff and the specimen is sent to an outside lab for processing. Append modify 90 to a CPT code indicate that although the provider is reporting the procedure, it actually was performed by an outside lab. Appropriate coding in this case is CPT code along with modify 90. The common keywords used to apply modify 90 is independent lab separate from physician. Modify 91. CPT Modify 91 is for repeat clinical diagnostic lab test. Modify 91 is used to signify a repeat of a diagnostic test or procedure on the same day. It is applied when the test or procedure is performed again to obtain additional or more accurate result. This modifier distinguishes the repeated service from the initial one. Modify 91 is not used to repeat a test due to equipment malfunction or lost test. Let's take an example. A 65-year-old male patient has multiple blood tests performed to check the potassium level. After the initial potassium level, 3 subsequent blood tests are ordered and performed on the same date. Coding for this scenario would be CPT code are equal to the number of tests along with 91 modifier with the subsequent test. The common keywords used in CPT to apply and modify 91 is subsequent lab test or repeat lab test before 24 hours. Modify 92. CPT Modify 92 is for alternative lab platform testing. Testing is performed using a kit or transportable instrument wholly or in parts consist of single-use disposable analytical chamber. Let's take an example. A female patient is concerned about HIV exposure. The patient is tested for HIV using a hand-carried transportable kit. Correct coding in this case would be a CPT code along with modifier 92. Common keywords used for using modifier 92 is transportable, portable kit, or disposable. Modifier 93. CPT modifier 93 means telecommunication system services. CPT codes may be used for reporting audio-only services when appended with modifier 93. Telemedicine service is defined as a real-time interaction between a physician or other qualified healthcare professional and a patient who is located away as a distant site. When using modifier 93, the communication during the audio-only service must be of an amount or nature that meet the same key component or requirement of a face-to-face interaction. A daily example of CPT telecommunication service between a doctor and a patient could be a telemedicine consultation. The doctor and patient engage in virtual appointment using at least audio conferencing or telehealth platform. This allows for remote communication, enabling the doctor to access the patient health, discuss symptoms, prescribe medication, and provide medical advice without the need for a physical office visit. For CPT Modifier 93, procedure may include keywords like physician and patients at the distant site or telecommunication services. If you have any question or need further clarification, feel free to reach out via email. It's time for a question and answer session. Let's get started.